Workplace injuries can happen when we're not careful, and when a worker gets injured, it affects the worker, his or her family, company, and society. When accidents happen, the most important thing is for the injured worker to get immediate treatment and then ensure a speedy recovery. Helping injured workers return to work aids the recovery process and is beneficial to both employers and employees. So, what can we do to help the injured worker get back on his feet and back to work? Introducing the Return to Work program. Return to Work, or RTW, is a tripartite initiative to help injured workers recover, remain at, or return to work. The RTW program supports injured workers through the help of a professional RTW coordinator who liaises with healthcare professionals, employers, and injured workers to develop a plan to help injured workers recover and return to work. Return to Work helps injured workers to recover with peace of mind, return to work safely, and maintain their employability. For employers and their companies, Return to Work helps to retain experienced workers, reduce turnover by avoiding the need to hire and train replacement workers, and enhance employee-employer relations. So, where does the Return to Work journey begin? First, a doctor assesses if the worker is medically stable and would face difficulties in pre-injury work when he or she returns to work. If the injured worker is suitable for the program, the doctor will refer him or her to a RTW coordinator. The RTW coordinator is a trained healthcare professional who works with the doctor, employer, and the injured worker to facilitate recovery and return to work. The RTW coordinator will meet with a doctor to better understand the injured worker's condition, assess his or her physical and mental well-being, and liaise with the employer to conduct worksite visits and evaluate job demands. Then, the RTW coordinator comes up with a plan to facilitate the injured worker's recovery and return to work process. During the recovery stage, the RTW coordinator monitors the injured worker's progress. Additional treatment, such as rehabilitative or counseling services, may be recommended. The RTW coordinator also collaborates with the employer to make adjustments, such as job redesign, to prepare for the worker's return. Once the injured worker successfully returns to pre-injury work with his or her current employer, the Return to Work program is complete. In cases where this is not possible, the RTW coordinator explores other options with the injured worker. Depending on the degree of functional impairment, the injured worker may be referred to government employment centers to find new job opportunities or to community services for vocational training or job placement. On average, it takes 6 months for an injured worker to return to work. This depends on factors such as injury type and severity, pre-injury health status, and nature of work and demands of the work environment. Let's hear from our professional partners.
Our journey started more than 10 years ago when the Tan Tock Seng Hospital's Occupational Therapy Department introduced our work rehabilitation services back in 2006. Then in 2010, we had the opportunity to work very closely with the Ministry of Manpower to conduct a randomized control trial where we introduced a return to work coordinator into our care. This allowed us to move from a clinic-based intervention into a more workplace-based rehabilitation service. We also then emphasize not just the clinical outcomes for the care of the patient, but also now his functional outcomes as well as his ability to return to work.
I think not only to the worker, I would say there are 3 parties that will benefit. As far as any patient is concerned, the earlier I can recover and regain my original function will be a real plus, a big bonus, and will be a real morale booster. Right? The second party that will be happy in this case actually will also be the employer, who know that my worker now can come back earlier, and I know what is going on. I'm kept in the loop, and I know how to help in the transition back to the worker's original role.
With the right support from employers, companies, and healthcare partners, an injured worker can recover well and return to work once again.